When people talk about variants of the COVID virus called SARS-CoV-2, we tend to use broad terms like Omicron and Delta, but scientists who track the virus can get a lot more specific. Epidemiologist Mark Zeller is with Scripps Research. He says they compared data from more than 80,000 COVID samples from the region, and the viruses they examined were constantly on the move, replicating and mutating.
And this sort of adds up to approximately one mutation every 10 days or so. So based on this information, we can sort of build a family tree of all the virus sequences we have.
In the Scripps Research study published in the journal Cell, researchers also wanted to determine how travel patterns affected the virus. They did that by looking at cell phone data that showed where people were and where they were going.
And we show a really good correlation between the connectedness based on the viral genome data and the travel data based on the cell phone.
Describing the movement of these viral variants depends on what part of the pandemic you're looking at. Scripps Research examined cases from the pandemic's beginning in 2020 to midway through 2022. Early on, travel restrictions and stay-at-home orders were common here and around the country. Add to that the reluctance of people to travel, and you have a very limited geographic spread of viruses. When those local mandates were lifted, it became a different story, as new variants were showing up in San Diego and spreading rapidly.
So typically, whenever a new wave comes in, the local transmission increases, right? Because, there's a new variant which has a lot of susceptible hosts within San Diego County, so it can just burn through those.
By late in the pandemic, about half of the viruses circulating were established local variants. The other half were recently introduced due to travel outside the region. One finding in the study showed that banning non-essential travel across the Mexican border had little to no effect on COVID risk in San Diego. Zeller says in general, targeted measures that try to stop the flow of people from a specific place are quite ineffective.
Because by the time you have detected these variants, it is probably already too late, and that variant has escaped the particular targeted area or targeted country.
There's no question. Restrictions on travel and social distancing regulations do limit disease transmission in an epidemic. But Zeller admits in an interconnected world, viruses will ultimately travel as freely as we choose to. Thomas Fudge, KPBS News.